We getting ready for the next panel. Please allow me to introduce and welcome Fadel, Shaltout, the Senior Investment Associate at Elevate Capital. Great. Feel free to, yeah. And the panelists will be introduced by Fadel, the moderator of this session. Great.
Thank you.
You want to do one by one coming on stage?
Yes. Hello, everyone. Welcome to the healthcare growth panel. So I'm going to introduce you to Severin Luebke from Palladium, Dorien Mulder from the Medical Credit Fund, Attua Afari from Yemaachi Biotech, and Becky Jones-Phillips from Liverpool School of Tropical Medicine, and Yaseen, the CEO of EMGuidance. As we all know, Africa faces a number of healthcare challenges, mainly inadequate funding, shortage of healthcare workers, poor infrastructure, and higher burden of disease, and weak health systems. This leads to inadequate access to healthcare. In terms of numbers from the shortage of healthcare workers, it's daunting. 25 doctors to 100,000 per population versus 200 doctors to 100,000 population in developed countries. This is due to inadequate training programs, low salaries, and difficult working conditions. Poor infrastructure makes it challenging for access of healthcare in rural areas. And the higher burden of disease, of course, especially communicable disease as HIV and malaria, and also higher rates of mortality from non-communicable diseases as cancer and heart disease. So if we start by talking about creating the resilient digital health systems. Access to healthcare remains challenging with ineffective coordination across the healthcare value chain. So if I might direct the first question to you, Yaseen, how can we ensure that digital health solutions are tailored to specific needs and capability of each nation, given that they vary in healthcare infrastructure and technology adoption?
Would you like us to introduce ourselves?
Sorry. Sorry, guys. So can we first make a quick, brief introduction about yourselves and your institutions? Yeah, sorry about that, jump the gun.
Okay, thank you. Thank you so much, Fadel, and good afternoon, everybody. Yeah. My name is Yaseen Khan. I'm a medical doctor by background with advanced qualifications in emergency medicine and epidemiology. And I'm based out of South Africa. And initially, post my clinical days, I did quite a bit of work with the South African national government in terms of developing and deploying technologies, clinical support solutions in the South African hospital context. And thereafter moved to co-founding EMGuidance, of which I'm chief executive for the last couple of years. Just a quick word on EMGuidance. It's South Africa's largest digital healthcare platform with respect to healthcare professional education, information, and e-prescription solutions. We work out of South Africa, but across sub-Saharan Africa as well, and particularly operations in Ghana. So keen to share some experiences with you with respect to our experiences in technology adoption on the continent. Thank you.
Becky.
Hello, everybody. Thank you very much to the organisers for inviting me to come and talk to you today. So my name is Becky Jones-Phillips, and I lead the Enterprise Innovation activity at the Liverpool School of Tropical Medicine. So my background is a PhD in infectious disease, so I don't claim to have any finance or investment background at all. And so as well as being having a research background, I also spent 10 years working in the commercial sector leading a diagnostics company. So I have a bit of a mixture of both commercial and academic background. And the Liverpool School of Tropical Medicine, for those of you who haven't encountered it before, so we're the oldest infectious disease and public health institute in the world, established in 1898. And our focus is very much around reducing the burden of poor health in low middle income countries. So we develop a range of different interventions, primarily focused on infectious disease and international public health, including maternal and neonatal health. And so we're interested in developing vaccines, diagnostics, therapeutics, but also where I'm specifically interested is actually how we also ensure that those interventions can be deployed and disseminated into healthcare systems that are able to support their use as well. So very much around developing innovation economies and how we can effectively conduct capacity strengthening across sub-Saharan Africa. So we work through a number of hubs that we partner with across sub-Saharan Africa, so predominantly in Kisumu, Kenya, in Blantyre in Malawi, in Zimbabwe and Uganda are the primary focus for us, but we have a whole raft of activity that is conducted across sub-Saharan Africa.
Now I have to test if the microphone works. Yeah, and if you're still awake. My name is Dorien Mulder. I work with a Dutch organization focused on increasing access to quality healthcare in Africa. The organization is called FunAccess, but one of the activities of the organization is Medical Credit Fund. While we were working on improving quality and realizing that much of the healthcare services are actually provided by private sector, we realized that they had limited access to financing. So that's why Medical Credit Fund was set up. We work in sub-Saharan Africa, have offices in Ghana, Nigeria, Kenya, Tanzania, and work in Uganda as well, providing loans to small-sized and medium-sized health enterprises, ranging from clinics, hospitals, pharmacies, to also suppliers to the health sector. And alongside these loans, we run programs on helping them to improve their quality using internationally recognized quality standards with the ultimate aim, and so it's not financing is the aim is to increase the quality of healthcare available to the population. I myself, I'm a doctor, but that's a long time ago, so I now focus on financing and working with mainly our local teams to do the work.
Severin?
Hi everybody, my name is Severin. I am the team leader for MOBILIST. MOBILIST is a UK, and I have no medical background, so if anything happens, you should be asking the people to the left and right of me. My focus is, or the focus of MOBILIST is primarily on public equities listings. The rationale for it is that, as I'm sure people have seen across the conference, lots of investments here are done through private vehicles, private fund structures, or private investments. And the aim of MOBILIST is to really try and get lots of these investments to scale up. We believe that public markets, so MOBILIST is a UK government-funded program. We believe that public markets, particularly around equity, offer a huge opportunity to provide the kinds of capital, the scale of capital that's needed to deliver on the kinds of outcomes, not just in the health sector, but generally. And yeah, so MOBILIST is based in the UK, but our focus is pan-emerging markets. So although here, obviously at AFSIC, I'm very much focused on the African continent, we also do investments in Southeast Asia, Latin America, and obviously potential listings here in London for those seeking access to finance or public listings.
Thank you.
My name is Yao. I'm co-founder and CFO for Yemaachi Biotech. Like Severin, I don't have any medical background. My background is in investment banking and private equity. Having spent many years working across sectors in Africa, I recently co-founded Yemaachi Biotech with 4 other co-founders. At Yemaachi, we're a cancer research company. Our goal is to leverage the genetic diversity of the African continent as a basis to develop the next generation of drugs and therapeutics. So Yemaachi is operating on the principle that modern humans evolved from the African continent, and Africa has the largest genetic diversity. So if you use African genetic data as a basis for research, then every product that comes out of that research should work for global populations. So we are active with partners in 9 African countries. We're gathering DNA and genetic data across the continent, and then we're partnering with global pharma companies to use that data for development of drugs and therapeutics.
Thank you, Al. So, as we know, access to healthcare remains challenging with ineffective coordination across the healthcare sector and the value chain. So my first question that I jumped the gun with. So Yaseen, if I might direct, how can we ensure that digital health solutions are tailored to specific needs and capabilities of each nation, given that they vary in their healthcare infrastructure and digital healthcare adoption?
Thank you, Fadel. I think this question about ensuring proper and effective digital adoption across heterogeneous African markets, it's something we often reflect on internally comparatively to our counterparts in the US or Europe or other large homogenized markets, that we have to think, because we look for scale, and each independent African market is relatively small, we have to look at scale across multiple markets. And I think the key overriding factor is one cannot underestimate localization when it comes to technology adoption. And I think the first thing is the recognition of the various parameters for successful technology localization, and that there are multiple. They include localization at the design level, at the user design, user preference level, localization with respect to local technical compliance, local data compliance. There is certainly, when it comes to health software particularly EMRs, clinical decision support systems that I have experience with, there's localization with respect to clinical data, which differs vastly from country to country.
Yeah.
The drugs, the guidelines, the policies, the rules all change, the burden of disease changes. And vast differences with respect to infrastructure connectivity, right? So you're designing for offline, you're designing for online, and you're designing for systems that have varying degrees of existing capabilities. And so I think the first thing, without before going into detail on any one of those, is the recognition from a planning perspective, at initium, that localization will take effort and there will be overhead. From an organizational perspective, we've experienced this localizing from South Africa to Ghana, both sub-Saharan countries, but what we've understood is that it's an investment primarily in product management at first. And often you don't account for that, right? You spec out the solution and you're looking at its deployment over the next couple of years, and you've really got to say, well, we need to invest in proper and effective product management, which would mean genuine user engagement, local user clinical engagement on the ground in that country. Yeah. You've got to factor in that costs. And I think that's the starting point, right, to understand that a product management investment in localization has to be factored in. And then if I just touch on, without going into all the details, just touch on one of the parameters. I think we underestimate design and how much software design impacts adoption, and how slim the margins are for getting design right according to local preferences. So the biggest and most kind of well-documented analogy to this is in the e-commerce sector. It's well documented that if you look at Chinese versus US e-commerce sites, Chinese e-commerce sites are incredibly busy. They've got pop-ups all over the place if you go to Alibaba, comparatively if you go to Amazon. And that's quite intentional. It's quite by design that the users in the East seem to value that kind of busyness comparatively to the West, and it's a cultural factor, it's a design factor. And I'm using that as an example just to understand we should never underestimate, for successful adoption, one's really got to think of successful design, and it's really important to think about sort of the local on-the-ground design factors, user design, particularly technology design, and one really has to go all the way, to achieve success. So there's probably quite a bit more to unpack there, but I think I trust that's fine for now.
Yeah.
Thank you.
So if I may just jump to Yao, you deal in research data, and so what steps can be taken to promote that seamless exchange of health information across different systems and platforms between countries and stakeholders?
Thank you, Fadel.
Yeah.
Similar to what Yaseen said, Africa, first I think we have to recognize that Africa has a lot of different countries, a lot of different systems. So the first step is being able to recognize that to be able to standardize a process, you need to recognize the nuances and the different systems that each country has and sort of tailor specific solutions that work well for those specific countries. So a perfect example is what Yaseen talked about, that there are different markets and there are certain things that may appeal to them. That said, we need to find ways to standardize certain kinds of data so that, if you want to achieve scale, you need to be able to have a platform where there's certain fundamental data that is standardized across board. So for example, at Yemaachi, we collect biological data and clinical data across, to date, we have 23 partner institutions across the African continent. Yeah. So when we started building our relationships, we went to each of these institutions to figure out what are your processes, how do you collect data? And then we use that information to build our own in-house clinical management software. So we have a dev team that builds these things, taking into consideration design, like Yaseen said. And what we've done is that we have a standard list of things that we need our partners to be able to provide us when collecting that clinical data. So if we go to a partner that's, let's say, out of our list of standard items, if they don't have it within their network, we say, okay, this is very critical for the research that we're doing. We need to figure out how to include this. Once beyond the standard, then we sort of have variables where there may be research interests from different parties who are performing research. Then it's sort of a variable segment where people can input additional data. But what we've tried to do is we've tried to create a standard and then allow for flexibility so that at the baseline, we have standardized data that we can use for our research. Because at the end of the day, our clients, for that data and for the research that we're doing, is global pharma. Yeah. And when global pharma come to us and they want to do a project across Africa, yes, they understand that Africa has 54 different countries, but they are looking for, if they want 1,000 samples from 10 different countries, they are looking for specific data, and we need to figure out a way to standardize it, and that's how we go about it.
Yeah. Thank you, Al. One last question regarding the digital health systems. How can African countries, with EMGuidance, you have a huge adoption with the healthcare providers. Nearly 70% of doctors in South Africa, if I remember correctly, when you told me yesterday. How can the countries invest in training and upskilling healthcare professionals to maximize the benefits of these technologies? So how can you leverage EMGuidance to do that?
Thanks, Fadel. I think success is really effective adoption, and I think the starting point for this is, and I referenced the previous question, it really starts with the design and having a solution that really works. And I think one of the challenges when health technologies are sort of top-down put to healthcare professionals is that healthcare professionals are often seen as data collection agents, and the solutions typically don't speak to the typical pressures on the front line. And so I think the first question is making sure that the design is correct. But even once you've achieved that, I think the key starting point for adoption overall is to really expect uphill. And to expect that change management in technology adoption is really going to be part of the process. It needs to be planned for, needs to be factored in, needs to be costed. So we look at our e-scripting solutions, for example, at the hospital level. We really have to factor in the support requirements, the training requirements, and the fact that there'll be a tail end, and it will be ongoing with respect to that. I think that if you take it a little bit of a step forward, the key thing is that, and this is a subtle difference that we pick up when, if you have sort of institutional technology adoption, typically in a hospital system or government system, because users, healthcare professionals, are often just forced to use a system. There's a very, very easy trap to fall in, that we can just force them to use it. And if you compare to to technology providers in the B2C space that really have to get consumers without sort of an enforced institution enforcing usership, they really have to think very carefully about user activation. And they design strategies and tactics to activate users. And many of you will know, if you use mobile apps, you'll often get little emails or pings, or the interface will change. And it's a very carefully designed strategy reflecting on the importance of getting a user to use a piece of software. And I think that those tactics and strategies around user activation and getting technologists, getting healthcare professionals to use technology, that's probably something that can be invested in. I think my last general thought on this is that somewhere along the line, digital health technology adoption has to make its way into medical school curriculum. I think, Fadel, you probably, like me, it was never taught.
Yeah, never.
And I think that's probably something at the sort of general level that can be deployed.
For sure.
Thank you.
So if we can move on to address health security. So ensuring health security is important, of course, and the COVID-19 took the whole world by surprise, and lessons have been learned from COVID-19 pandemic. How can, I'm addressing to Becky as the Liverpool School of Tropical Medicine, how can global health security be strengthened for future pandemics by investment in the African health and life sciences sector?
Thanks, Fadel. Yeah, so I think there's lots of things to mention there. I might start by talking about, so the Africa CDC last year announced a new public health order, which was very much focused around building resilience and preparedness in the event of whether it be pandemic preparedness, but broader public health strategies. And that public health order was built around 5 key pillars, which I think are very important and critical to that particular question. So one was around building resilience and robustness within public health institutes. And then the second was around building resilience and strengthening workforce development as well in the public health space. Also around looking at sustainability for manufacturing, for diagnostics, vaccines, and therapeutics, which is critically important in terms of the sustainability piece in the event of new and emerging infectious disease risks. The fourth element was around stimulating in-country investment as well as being critical in terms of being able to address that need. And finally, building action-orientated partnerships for mobilization and for trying to drive activity. So I think just to expand and maybe dive into some of those points in a bit more detail. So I think that absolutely critical is increasing capacity strengthening around surveillance. So that's really important from the perspective of biosecurity, but also thinking about genetic epidemiology as well. And I think that's where that very much resonates with the previous discussions around big data and digital health and technologies. So I think that's something that absolutely needs to be focused on to a greater extent moving forward. Also, clinical trials capacity strengthening is really critical. And I think that some of the statistics are really quite staggering when you consider the current landscape with regards to clinical trials in Africa. So you have a scenario where you have 17% of the global population residing within Africa. It has 25% of the global burden of disease, and yet only 2% of clinical trials are being conducted in Africa. Yeah. And that's a real issue. It's an issue from the perspective that it's a missed opportunity with regards to investment. So there could be certainly huge wins there for pharmaceutical companies and for vaccine companies that could be conducting clinical trials. So I think from an investment perspective, massive missed opportunity there until that situation is addressed. And just fundamentally from the perspective of building an equitable ecosystem, you have a scenario where you have interventions that are being developed and deployed and embedded within African healthcare systems. And these are new interventions that the clinical trials have never been done on African populations. So you're not considering the genetic diversity, and we just heard earlier about how important that is in terms of just the variation and the genetic diversity that resides within the African population. And also the immunological background as well is not being considered, which is hugely important when you consider vaccine development in particular. So I think that's another area that really needs to be focused on moving forward in terms of pandemic preparedness and resilience. I think clearly lots of conversations going on about manufacturing in country and how important that is in terms of building sustainability and independence. The African Union and the Africa CDC formed the Partnership for African Vaccines and Manufacturing framework. And that has a really bold ambition of developing 60% of Africa's vaccines by 2040, which is a really tough ask, I think, in terms of how things are going to progress to that stage where that's possible. So that absolutely has to be something that's considered moving forward, and the mechanisms for how that's made possible. And I think as colleagues on the panel will go on to discuss, also considering the financial models as well. So I think building the value proposition for investment in some of these areas is quite hard when you consider that at the moment the financial models are very much dominated by global north donors, philanthropic organisations, NGOs, public development partnerships. So we really need to think about how we can try and encourage and promote more commercial and private investment into this space to make things.
Yes. This brings me to my next question. We know that Africa has the lowest per capita health expenditure and is dependent on traditional development aid. This has been a significant source of funding. How can we move towards a more sustainable financing model for healthcare to reduce the dependency on the aid, Dorien?
Yeah, this is the easiest question today.
Easy,
No.
Very easy.
I think many people don't realize that in many African countries, about half of the healthcare expenditure is out of private pockets. It's not channeled through the government or coming from donors. It's people paying at their local pharmacy. It's people paying in the clinic next door out of their pocket. And I think that to have more resources for health, you need to be able to mobilize or channel that money into the right direction. And at least, I think, speaking to the issue of data, we hardly know what it's spent on, and we don't know if that is efficiently spent or not. So I think we should consider local or kind of abandoning these local private contributions to healthcare and make a better private-public collaboration, because also private sector healthcare providers have a lot of capacity that is often not seen and complements the government, but maybe also competes in ways, but complements the government as well. So I think we have to look at collaboration there to mobilize the resources that are available in the African continent. On the other side, spending on healthcare is directly related to economic development. So as long as we don't have GDP increasing, you have limited money available to spend on healthcare. So you better spend it wisely on things that make sense. And in order to make investments in healthcare infrastructure, for example, viable, there need to be somebody picking up the healthcare bill in the end. So that there is no investment in healthcare if there's ultimately no money available to pay for that healthcare. So now, bottom line, and work together with private sector and pool resources, and maybe health insurance systems, which are increasingly being seen in Africa, but still in their early days, not always are managed transparently and well. So I think there we also need data and collaboration and transparency to make that happen.
Thank you, Dorien. Severin, with MOBILIST, you deal with public equity investments in Africa. What role can impact investing and innovative financing mechanisms such as social impact bonds play in attracting investments in African healthcare systems?
Sure, thank you. I think those are two ends of the spectrum in my mind, the social impact bonds and then the public equities space that we work on as MOBILIST. And I think that has to be at the center of the recognition of the size and scale of challenge that we're facing, which is that in some cases it is really a question of trying something new, incentivizing people to try something new, which is the social impact bond case, I would argue, where you're trying to incentivize wider public actors to work towards a specific outcome. But the side that we're working on is the much larger scale, the public equity space. And I think sometimes, because we're talking a little bit about creatives and sustainable solutions, that public equity space has really been underutilized, generally speaking, but particularly in the healthcare system in sub-Saharan Africa, or in Africa generally maybe. And I think part of that is because it doesn't recognize the infrastructure that all of the conversation that we're talking about is based on, right? There are people who want to invest in the ecosystem, but they have very specific constraints around the level of risk they can take, the amount of liquidity they need in the system, and there are assets for them to purchase or buy into, such as the wider healthcare infrastructure, and I mean sometimes the physical infrastructure, but also sometimes the biomedical infrastructure. And I think what my hope is, or my encouragement would be, is that if you're going to solve such a broad-based problem, then you have to think about the solutions at the smaller scale, which is the impact investment approach, which focuses on very specific challenges. But you have to also take into account that, and this is the point Dorien was making, societies grow in terms of wealth. Their pension funds grow in terms of size. Those kinds of pools of capital have a responsibility or a role to play in the public infrastructure that the healthcare system builds upon. And I think that's really what we're trying to encourage at MOBILIST, is to think about problems not just in a very small scale of one specific fund or one specific company, but to say, okay, the entire ecosystem and the entire infrastructure needs capital, and it needs it at a scale that individual private equity funds or individual company investments simply won't do. So we have to think about the challenges at a much bigger, at a much bigger scale. And I think that has so far not been a solution that people have been focused on. It's still been very heavily focused on fund structures or individual VC or private equity focuses.
Can I have your take, Dorien, on also these innovative funding mechanisms?
Yeah. I think maybe 2 points. We focus on a different kind of company than Severin is talking about. Severin thinks that he wants to roll up all our small pharmacies across the continent into one big company.
Not me personally.
And put it on the stock exchange. No, not you personally. Maybe that's the ultimate goal of having efficiencies but at the moment it's a very fragmented market where there's many small companies needing different kinds of investment, and they are not ready to enter public markets. Second one is, I think mobile technology can play a huge role in reaching patients, not only patients, but also connecting patients to clinics. And we have developed a product using mobile money, which is very frequently used in Africa, to provide loans to small-sized healthcare providers. So I think mobile money in general can play a role, maybe also in channeling the resources for health and in investing as well. Thank you.
Thank you everybody for this productive discussion, and thank you to the audience. That's it for our panel discussion. Thank you.